I'll be meeting with the largest pharmaceutical companies in the world, actually. They'll be coming to the White House, and we're talking about a vaccine and developing for the virus, to combat the virus. And I'd like to just ask and caution that the media, we would respectfully ask the media and not do anything to incite a panic, because there's no reason to panic at all. The country's doing very well. Our professionals are doing really an incredible job. We're also working with other countries to help them.
Are you also considering a national emergency declaration that would allow states and local governments to convene?
I don't think you'll need that, because I really think we're in extremely good shape. We're prepared for anything, and we could always do that at a later date if we need it, but I don't think we need that.
Today, the global death rate at 3.4%, and a report that the Olympics could be delayed. Your reaction to that?
Well, I think the 3.4% is really a false number. Now, this is just my hunch, but based on a lot of conversations with a lot of people that do this, because a lot of people will have this, and it's very mild.
Anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the tests, and the tests are beautiful. Anybody that needs a test gets a test. This was something that we were thrown into, and we're going to handle it, and we have been handling it very well. The big decision was early when we shut down our borders. We're the first ones ever to do that. We've never done that in our country before. It will go away. Just stay calm. It will go away. We want to protect our shipping industry, our cruise industry, cruise ship. But everybody has to be vigilant and has to be careful. But be calm. It's really working out. After consulting with our top government health professionals, I have decided to take several strong but necessary actions to protect the health and well-being of all Americans. To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight. We want to lose as few people as possible. So important. And what is the number as of this morning? Is it 32? You could tell me. Is it 32 deaths, Steve, around that? I mean, 32 is a lot. 32 is too many. But when you look at the kind of numbers that you're seeing coming out of other countries, it's pretty amazing when you think of it. I'm officially declaring a national emergency. Two very big words.
Have it even if you don't have symptoms. Are you being selfish by not getting tested and potentially
Well,
exposing?
I didn't say I wasn't going to be tested.
Are you going to be?
Most likely, yeah. I also took the test last night, yeah. And I decided I should, based on the press conference yesterday. People were asking, did I take the test? I don't know, whatever it takes, a day or 2 days. You know, just wait a minute. Just take it nice and easy, okay? Just relax. People come up to me. They shake hands. They put their hand out. It's sort of a natural reflex, and we're all getting out of it. All of us have that problem. You don't have to buy so much. Take it easy. Just relax. People are going in, and they're buying more. I remember, I guess during the conversation, Doug of Walmart said that they're buying more than they buy at Christmas. Relax. We're doing great. Hit it at 10. I think we've done a great job. And it started with the fact that we kept a very highly infected country, despite all of even the professionals saying, no, it's too early to do that. We were very, very early with respect to China. And we would have a whole different situation in this country if we didn't do that. I would rate it I would rate ourselves and the professionals. I think the professionals have done a fantastic job. That if we do a really good job, we'll not only hold the death down to a level that is much lower than the other way, had we not done a good job. But people are talking about July, August, something like that. So it could be right in that period of time where it washes through. We have an invisible enemy. We have a problem that a month ago nobody ever thought about. Nobody I've read about it. I read about many years ago, 1917, 1918. I've seen all of the different problems similar to this that we've had. This is a bad one. This is a very bad one. This is bad in the sense that it's so contagious. It's just so contagious. Our guidance yesterday urges Americans to take action for 15 days to help stem the outbreak. I would say it's a 14-day period. It's 15 days from yesterday, and we're asking everyone to work at home if possible, postpone unnecessary travel.
In states with evidence of community transmission, bars, restaurants, food courts, gyms, and other indoor and outdoor venues where groups of people congregate should be closed.
So, Mr. President, are you telling governors in those states then to close all their restaurants?
Well,
and
we
their
haven't
bars?
said that yet.
Why
We're
not?
recommending,
But
but
if you
we're
think this will
recommending
work.
things. No, we haven't gone to that step yet. That could happen, but we haven't gone there yet, please.
The president was saying this was going to go away. It's April.
It is gonna go away.
But Mr. President,
It
you
is going
said it
away.
was going to go away in April. You said
I
when it
didn't say
warmed up in
date.
April.
I said it's going away, and it is going away. So supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or?
We're dying. That's true. And it is what it is. But that doesn't mean we aren't doing everything we can. It's under control as much as you can control it. This is a horrible plague that beset us.
You really think this is as much as we can control?
200,000 dead. As you said, over 7 million infected in the United States. We, in fact, have 5%, 4% of the world's population, 20% of the deaths.
If we would have listened to you, the country would have been left wide open. Millions of people would have died, not 200,000, and one person is too much. It's China's fault. It should have never happened.
Just
I wear
like your
masks
rallies.
when needed. When needed, I wear masks.
Okay, let me ask.
I don't wear masks like him. Every time you see him, he's got a mask. He could be speaking 200 feet away from it. He shows up with the biggest mask I've ever seen.
Later in that week, everybody awoke to this headline that the president and the first lady had tested positive for the coronavirus.
Not since when President Reagan was shot in an assassination attempt nearly 40 years ago has there been this level of concern over a president's health.
So it's been a very interesting journey. I learned a lot about COVID. I learned it by really going to school. This is the real school. This isn't the let's read the book school. And I get it, and I understand it.
He gets out of Marine One and he walks up a stairway to a balcony at the White House, rips off his mask, tucks it in his pocket in a kind of defiant way, and then stands there. You know, it's the reality TV president staging a reality TV event to say, I'm strong, I'm back, I'm healthy.
And one thing that's for certain, don't let it dominate you. Don't be afraid of it.
People continue to be hospitalized, people continue to die from this, and yet the President of the United States continues to act as if it is mostly in the rearview mirror.